Hi guys, welcome. Today we're going to be talking about myocardial ischemia. We're going to be talking about what it is, what causes it, some of the manifestations, meaning how it appears, treatment, and also the pathophysiology, like the process in which it takes to happen, basically. And the information is going to be from my slides. I'm just going to reiterate it in the way that I understand. Okay. Let's get started. We're going to start with the definition. So what is myocardial ischemia? Myocardial ischemia is when the heart muscle don't get enough blood and oxygen because one or more of the coronary artery is narrowed or blocked. And it can also be due to coronary spasms, which is just when the muscle tightens, when the artery tightens. So it's just a squeeze or a contraction or just a tightening when it gets tightened. Okay, so that's basically what it is. But in layman's term, myocardial ischemia happens when, before we continue, we know what the coronary artery does, right? We know that the coronary artery supply the heart itself with oxygen. So let's take a look right here. So these are the coronary artery, this one, and then right here. So it's in the heart, and we know that it's, the heart sends blood everywhere throughout the body. Well, it needs blood itself, it needs oxygen, it needs to breathe. So the coronary artery is what supplies the heart with blood. And what's the impact? So we know that blood carries oxygen, so the coronary artery basically carries oxygen to the heart through the blood, in layman's term. That's pretty simple, right? So that's basically what that is. So when there's reduced blood flow, that means the coronary artery is not bringing enough blood to the heart, and that means the heart is not getting enough oxygen. And we know what happens when there's not enough oxygen. We're not gonna jump ahead right here, but by definition, let's break this down. What is myocardial ischemia? From the word. Myocardial is just the muscle in the heart. So let's say heart muscle. Ischemia, reduced blood flow. This is very important. Please remember what ischemia means. Ischemia is just reduced blood flow. So what did we go over so far? We said that myocardial ischemia happens when the heart doesn't get enough blood, hence it doesn't get enough oxygen. Why? Because the coronary artery is narrowed or blocked, or coronary spasms. But let me give you a mental image. So this is what it is. So this is the normal coronary artery, right? We said it's in the heart. We said it supplies the heart with blood, where in turn supplies the heart with oxygen, right? So this is the coronary artery. This is the normal one. Look at the artery wall. Pretty good. And this is the blood. A good amount of blood coming out, right? And then this is where it's narrowed. Look at the amount of blood coming out in comparison. This is a big difference. It's a huge amount of blood in comparison to this one, right? And remember, I said it happens because of a blockage, the plaque. Guys, if you didn't watch my video before, go and watch the first video where I talk about coronary artery. It's a pretty comprehensive video where I go through the plaque and everything. So we see that the plaque is what is causing the narrowing, because it takes up so much space here and it narrows the artery. So this confirms the definition, where it happens because the heart isn't getting enough blood. Why? Because the artery is narrowed or black, which we can see here. It's narrowed and black in this picture. So the blood supply is smaller. So there's a reduced blood supply. Okay. And now the definition also says, or I also said, that it can be caused by coronary spasms. Let's take a look at this picture. This is what it is. So this is the normal one, right? Look at the amount of blood coming through. Good amount of blood in the normal artery, right? And then this is where there's a squeeze. There's a squeeze or a tightened artery right there. And then the amount of blood coming through is so much smaller, a lot smaller. Look at the comparison. Look at the difference. That's a lot smaller. So we can confirm that the narrowing right here, the plaque, and the spasm cause reduced blood flow. And that's what myocardial ischemia is, right? Reduced blood flow. And look at this also, there's this image. So this is where it spasms or tightens. This is the amount of blood coming through first. And because it tightens, the amount of blood coming through is so much less. So we can say that there's reduced blood flow. Why? Because of the narrowing. The artery narrows, it's blocked, or there is vasospasm or coronary spasm. Because spasm, it just squeezed or it tightens. That's basically what it is. So we understand that myocardial ischemia is when, as we said, myocardial. Just look at the word itself and define it. Myocardial ischemia is when the heart muscle gets reduced blood flow. Why does it get reduced blood flow? Because the coronary artery is blocked, narrowed, or there is vasospasm. Pretty simple, right? So now we're going to look at the risk factors. So risk factors are causes. The first thing that we're going to talk about is the plaque. We're going to talk about plaque. Guys, watch the video before, please. So plaque, what's the plaque? This is the plaque in this picture. This is the plaque. How does that cause myocardial ischemia? We know why it cause myocardial ischemia, right? It caused myocardial ischemia because it caused a narrowing in the artery and it reduces blood flow. That's pretty simple, right? So it caused the narrowing, which causes reduced blood flow. And that's basically what it is. So the plaque causes the narrowing because it takes up space, and that leads to reduced blood flow. Oh, I'm sorry guys, I needed to tell you that we're gonna divide the causes of myocardial ischemia into two categories. We're gonna talk about supply and demand. We're going to talk about supply, and I'm going to tell you why after. So we're going to say this is supply. And by supply, I mean it reduces blood flow. So it causes myocardial ischemia because it reduces blood flow. There is less supply. So the plaque caused there to be a less supply of blood, and we already know how it takes up space, it causes the artery to narrow, and so it reduces blood flow, right? So the supply of blood to the heart gets less because of the plaque. That's basically what I'm saying. Now we're going to talk about the spasm. We already went over the spasm, but I'm just going to add it here as well. So the spasm, we know the spasm causes less blood to the heart. Why? Why? You guys know why, so tell me why. Because it squeezes the arteries, the coronary artery, reducing blood flow. And we know how it does that. We know it just spasms, squeezes, and we see it right here. So it reduces blood flow, right? That's pretty much how. And so we went over the plaque, we went over the spasm, and we know that we're talking about the less supply of blood to the heart. And now we're going to talk about low blood pressure or hypotension. Let's say hypotension because it's the most clinical term or medical term. Hypotension. What's hypotension, guys? It's just low blood pressure. Hypotension, just think of it as the amount of blood pushed through the artery. Just the amount of blood pushed through the artery. So we're just going to say amount of blood pushed through the artery. And that's basically how we're going to define it. So low blood pressure. If there's low blood pressure, that means there's a low amount of blood being pushed through the artery. Did you guys get that? Hopefully you got that, because That's a really good way to think of it. A low blood pressure means low blood is being pushed. Low blood pushed. So low blood pushed. That's how I'm gonna think of it going forward as well. So low blood pushed. So how does hypertension cause less supply of blood to the heart? Basically, the definition, there's less blood being pushed through the arteries. If there's less blood being pushed through the arteries, what's gonna happen? Less blood is gonna be going to the heart. That's basically it. So we already talked about the plaque. We said the narrowing causes reduced blood flow. Why? Because the narrowing the plaque takes up space, which causes the artery to narrow, reducing blood flow. Spasm squeeze the artery, reducing blood flow because that tight part, not a lot of blood cells can get through it, so that reduces blood flow. And hypertension, which is low blood pressure, means low blood is being pushed. If there's not enough blood being pushed, it's just simply the same thing, reduced blood flow. And that's basically it. But let's just say hypertension. Let me use the same color. Low blood pushed equal reduced blood flow. So that's pretty straightforward, right, guys? If you have any questions, just leave a comment and I'll get to it. Yeah, so the next thing that we're gonna do is anemia. Anemia is have you ever heard someone say they're anemic? What does that mean? They have low blood count. So that's basically what it is. If you have reduced blood count, let's say reduced So that's what it is. It's just reduced O2 carrying capacity blood count. So you know how when you're anemic you have to take iron, right? If you have to take iron just allows your blood to carry oxygen better. That's basically how you'd say how anemia works. So even if your blood, because we are walking around with our blood fine, or we have a good amount of blood that's working in our body, but we're still anemic because that blood isn't rich in oxygen, so it's not supplying what it's supposed to supply, basically. So anemia means reduced oxygen, and that's how it causes myocardial ischemia, because we know myocardial ischemia is how it happens because of reduced blood flow, which causes reduced oxygen. So we just jump the reduced blood flow and go right to reduced oxygen, and that's what caused that. Yeah. Okay, guys, so now we're going to be talking about more demand. So we talked about less supply. Now we're going to be talking about more demand. So basically what I've done where the causes of myocardial ischemia, we broken it into two categories: less supply, where it reduce oxygen to the heart, and more demand, where it caused the heart to want more oxygen, right? So what would cause the heart to want more oxygen? And think of it critically. Think of it like, what kind of activities would you be doing to want on your heart be like, okay, I need to rest, I just need more oxygen? What kind of activities would cause that? It's simply what more demand means. So we're gonna start with exercise. Sorry. We're gonna start with exercise because it's basically the premise of everything, if I'm being honest. So exercise. How does exercise cause more demand? Because you need more fuel. It's pretty simple here, right? So exercise. If you're exercising, your heart's gonna need more oxygen, more blood. If it doesn't have enough blood and doesn't have enough oxygen, then it's only making things worse. Ischemia, myocardial ischemia, because it's using up everything that it has in exercise. So now it has less, basically. So it uses more fuel. And then tachycardia. What is tachycardia? Tachy means fast, cardia means heart. So fast heart rate or fast heartbeat. Okay, how? Same way, right? Same way, pretty much the same way. If your heart is beating fast when you're exercising, your heart, if your heart is beating fast, what does that mean? It's using more energy, it's using more fuel. It's like you're exercising, your heart just starts beating fast. That's basically what it is. Yeah, that's literally basically what it is. So it's using more fuel. It's just the same thing. And then high blood pressure. Earlier we said that what's hypotension? Let me rephrase this. I don't want to say high blood pressure. I'm going to say hypertension. Hypertension. So that's high blood pressure. Remember we talked about low blood pressure, and we said low blood pressure is low blood pushed, right? High blood pressure is high blood push. You're pushing out more blood than you have. You're pushing out way more blood than you have. So what does that mean? That means you're using up the fuel as well, right? There you put it. High blood pressure. So you're gonna say high blood pushed. See? That's pretty much it. So we're gonna go over the causes again. So plaque, we know that the plaque takes up space, narrows the artery, and reduces blood flow. We know that spasms squeeze the artery, reducing blood flow. We know that hypotension means low blood push. If there's not a lot of blood being pushed to the artery, not a lot of blood is getting to the heart, so reduce blood flow. So low blood push, reduce blood flow. Anemia means that the blood that's already in the body doesn't have oxygen. So that means the heart's not getting oxygenated, so reduced blood flow or reduce oxygen blood flow. Let's say reduce oxygenated blood flow. Let me add that. Reduce oxygenated blood flow. And guys, remember when I'm saying reduce blood flow, it's all about the oxygen. Because remember what the heart wants is not just blood, it wants oxygen. So reducing blood flow equals reduced oxygen. Maybe I need to make that clear. Reduce oxygen. It's all of them, guys. I don't even want to write all of them out again. Just reduce oxygen. Again, the plaque narrows because it takes up space. The plaque causes the artery to narrow, taking up space because it takes up space, reducing blood flow, which reduces the oxygen going to the heart. Spasms squeeze the artery, reducing blood flow, which reduces the oxygen going to the heart. Hypotension means low blood pushed, or low blood pressure, low blood pushed, reduced amount of blood pushed to the artery, low, reduced blood flow. Reduced blood flow means reduced oxygen. Anemia, the blood flow is not the problem here. It's not the price, it's the richness in oxygen that the blood has. In anemia, in anemic patients or anemic persons, the blood is there. The blood is there. It just doesn't have enough oxygen. The blood is just not good. It's not oxygenated blood. So, and in anemic patient, it's reduced oxygenated blood. Reduce oxygenated blood. So in anemia, it's all about oxygen, right? It's all about oxygen-rich blood, and that's what they don't have. If they don't have oxygen-rich blood, we're getting reduced oxygen to the heart, basically. So, and then the other thing is demand. We said if exercise, you're using up more fuel than you have. In tachycardia, if you're tachycardic, your arch is beating fast. You're using up more fuel because your heart have to work more to push more blood through. And if you're pushing more blood through, you're literally not left with any, because you're not being fed and you're giving people your food. That's basically what it is. So more demand means you don't have it. And you're just giving away. So you're hungry, but you just keep giving people food. You exercise and you don't have oxygen, giving the other muscles food. When your heart is beating fast, you have to compensate. So you're giving other muscles and other things food. When you're pushing more blood, you're giving other things food. So with more demand, it's all about giving away what you don't have. Less supply means this is what's causing you to not have it. And then more demands mean you're giving it away to these things. That's pretty simple, right, guys? So let's go over it. We know what myocardial ischemia is. It's when the heart's not getting enough blood while reducing the oxygen. Let's say this is the effect. This is the effect, reducing the oxygen. So it's myocardial ischemia is when the heart muscle is not getting enough blood, hence reducing the oxygen, because the artery is narrow, block, or spasm. And we know what myocardial ischemia is, and we know coronary artery supplies the heart with blood and oxygen, right? Or with oxygen from blood. So we know the narrowing, we know the plaque causes the narrowing, and that causes reduced blood flow right here. We know that. And then the spasm, squeeze the artery, less blood's going through. And that's pretty much by definition. And we know that the risk factor is because of supply and demand. How much you have and what you're giving away. How much you have, what you're giving away. So these are the things that's causing you to not have enough. And these are the things that's causing you to give it away. So there's an imbalance, right? That's basically what I'm saying. We already went through this like 10 times. So the plaque, we know why it's reducing blood flow. We know why all of these are reducing blood flow. And why all of these are causing you to give away the food that you don't have, right? So we know that. Talk about the pathophysiology of how it happens. Okay, so what we're going to do is think about this. I'm going to compare it to a leg. So I'm going to compare it to a leg, and you have to bear with me, guys. So what do we know? We know that the muscles in the leg need oxygen. So muscles need oxygen, right? To make energy. And what do we know? Oxygen is delivered by blood. So we know decrease in blood equals decrease in oxygen. And decrease in oxygen means lactic acid buildup from anaerobic respiration. How we know lactic acid causes pain. So now here's where the comparison comes in. So go over this. The muscles need oxygen to make energy. When oxygen is delivered by blood. When there's not enough blood, not enough oxygen gets delivered. When there's not enough oxygen, then we know anaerobic respiration occurs, where lactic acid is being used instead of oxygen, and it builds up. And then lactic acid causes pain. That's very important. Now we're going to talk about the heart. So now in the heart, same thing. Muscles need oxygen. Guys, I'm not going to repeat everything. So if there's decreased blood, there is decreased oxygen. And we know why there's decreased blood. Because of the plaque, because of the spasm, because of anemia, because of hypertension. So we know all of those things. That's the supply part and the demand. We already know the demands of why there is decreased blood, right? And we know now the heart switch to anaerobic rather, and that means lactic acid. And if this happens because we know when you get muscle cramps, if you sit and let your body recover, oxygen start going to your leg, everything is fine. So this is the problem. We don't want this to go for if it go for 20 minutes or less than 20 minutes, we can recover, right? This is very important. And if it goes for greater than 20 minutes, you can have a heart attack and die. and die, literally dead. I already know the lactic acid causes pain, chest pain. So this is what we know, guys. This is really what we know. We think about it, muscles need oxygen to make energy. When there's not a lot of blood, and we know that blood delivers oxygen. And when there's decrease in blood, there's decrease in oxygen. And that means if there's decrease in oxygen, we're going to have what? Anaerobic respiration, where there's lactic acid being used. And we know lactic acid causes pain. If this happens for less than 20 minutes, we can recover. So if we just get oxygen, if they bring the oxygen fast to these muscles, to the heart muscle, then we can recover. If we're out of oxygen for greater than 20 minutes, then we're going to have a heart attack and we're going to die. We cannot recover if it's greater than 20 minutes. Okay? That's pretty simple, right? So we know how it happens. It happens because muscle need oxygen to make... See, this doesn't even need the leg comparison. It's just the same thing. I was just thinking to think about when you have like a cramp in your leg, that's lactic acid. Why? Because you're running too fast, your leg isn't getting enough blood, your leg isn't getting oxygen, so now you're using lactic acid and now you're having cramps and pain, but you recover because it's been less than 20 minutes and then you start getting oxygen. That's the point that I wanted to make. So muscles need oxygen to make energy. We know what delivers oxygen: blood. And if there's less blood, then there's less oxygen. And if there's less oxygen, then lactic acid builds up, and then lactic acid causes pain, but the pain isn't relevant here. The thing is how long we're using lactic acid for. If it's greater than 20 minutes, we can't recover, but we need it to be less than 20 minutes to recover. That's basically the pathophysiology. Okay, so now, guys, we're going to talk about the types or the manifestation of myocardial ischemia. Basically how myocardial ischemia shows up, basically. So we have stable angina. We all know by now that angina is chest pain. And stable means it's predictable, right? We know when it's going to happen, where it's going to happen, how it's going to happen. And well, okay, to say it's stable, it's constant, it's predictable. So we're just going to list those things, the features of it. So what do we know? We know that it's predictable. And what do I mean by predictable? We know when it's going to happen, so we know the onset, we know the situation in which it's going to happen, how long it's going to last, so we know those things, right? And it happens during activity. I'll explain why. Or stress. That's pretty simple, right? So please go and watch my first video on coronary artery disease, because I explain stable angina pretty well. So stable angina, how does angina occur? Because of this is how angina occurs. So let me just erase these. So angina occurs because of this. So it happens because of the plaque buildup. Let me just give you a simple definition. So stable angina happens because of reduced blood flow. From what? Plaque, which cause narrowing. So that's pretty much how. So we know that the plaque causes narrowing because it takes up space, so it reduces blood flow. That's how stable angina occurs. So stable angina is chest pain that's predictable, and it's caused by reduced blood flow from plaque buildup, which causes narrowing, which in turn reduces blood flow. Pretty much. It's predictable. We know where it happens, how long it lasts, and it happens during activity. Why does it happen during activity? Because of this. Muscles need oxygen to make ATP. If there's decreased blood, if there's not a lot of blood, then there's not a lot of oxygen. If there's not a lot of oxygen, then lactic acid buildup occurs. If lactic acid buildup occurs, then what? It causes pain. And that's exactly how chest pain occurs. Because there's reduced blood flow. Reduced blood flow what? Reduces oxygen, which reduces... You get the point. So it causes lactic acid buildup, which causes the pain. So that's pretty self-explanatory, right? And we know it can be relieved by nitrates. So nitrates just open the vessels and relaxes them and increase, so that in turn increases the blood flow. Yeah. No, presmental angina happens. Let's say this. When I think presmental, I'm gonna think unstable. Like they're definitely mental. So I'm gonna say unpredictable. Because remember, presmental, definitely mental. You can't even trust them. They're just very unpredictable. And because it's so unpredictable, and we know angina is chest pain, and because it's so unpredictable, we know it happens even at rest. Presmental at rest, you could be nothing, go doing nothing, and you just go mental. So at rest. But why does it happen though? It happens because of vasospasms, or coronary spasms rather. It's coronary spasms. Let's say coronary spasms. And we already know what coronary spasm is, right? Coronary spasm is this, where there is this tightening or squeezing of the artery, which causes reduced blood flow. And that's how that happens. Because remember what chest pain is: reduced blood flow, which reduces oxygen. Reduced oxygen causes lactic acid buildup. Lactic acid causes pain. And the only difference is this is unpredictable and it happens at rest. So that's the difference here. But we know that there's different causes, as you can see: stable angina, reduced blood flow, and presmental, coronary spasm. Now remember, presmental is really mental, so it's just unpredictable. And it can be caused by, or it happens, or triggers. Let's say triggers. So these are the triggers: activity or stress. And the triggers here can be smoking, stress, alcohol. So those are the triggers. And then the last one, here's an image. So this is basically what it is. So the coronary spasm, blood, reduced blood. This is not a great image, but we already see how that happens. Now, silent angina, by the name, we know from the term silent, we don't know if it's happening, when it's happening, where it's happening, how. So basically silent mean, let me see, how can I say it? So we already know what silent means by definition. So what I'm going to define it as is you just don't know it's happening. You don't know it's there. Why? Because it's silent and because there's no chest pain. But there's still reduced blood flow though, but just no chest pain because you don't know. It don't want to alert you, so there's no chest pain. When does it happen? And we know because of diabetes and nerve damage, so the brain isn't alerted. So yeah, that's pretty much it. So let's go over this. We know the types of the manifestation: stable angina, stable predictable angina, and chest pain. We know chest pain happens because of reduced blood flow, because reduced blood flow means reduced oxygen means lactic acid means pain, chest pain. And we know it's predictable. That means we know when it's going to happen, where it's going to happen, how long it's going to last for. And we know it happens during activity or stress, and it's relieved by nitrates. And then presmental, they're very mental, unpredictable. You can't trust them. Unpredictable chest pain, spasms. Spasms are unpredictable too, so that's a correlation. Spasms, we know spasm is a tightening, and when there's spasm, reduced blood flow. We know the process of our reduced blood flow causes chest pain. Unpredictable, so it happens even when you're resting. Not even when it happens at rest, only based on my notes. And the triggers, smoking, stress, or alcohol. And then silent angina, you don't know it's happening, you don't feel no chest pain or anything, it just happens. Just silently kill you, basically, because you're not feeling chest pain, you're not feeling anything. And one of the cause could be diabetes, because when you have diabetes, there's a lot of you don't feel a lot of things. That's why you have to be careful when you get cuts. So that's an entirely different discussion. But diabetes and nerve damage, so the brain doesn't get alerted, so you don't know it's happening, and you don't know it's there, and that can lead to a heart attack. That's very dangerous. So that's pretty much all for that. Now we're going to talk about management. So remember, when we're talking about everything, we're talking about the cause, we talk about two things that happen: the supply, the heart's not getting enough blood, and the demand. Everybody else needs something from it when it needs to take care of itself. So what do we need to increase? The supply. We need to increase how much the heart have and decrease how much it's giving away, right? So that's pretty much it. That's pretty much what we want. That's pretty much how we manage myocardial ischemia. And then these are the things that we use. I went in depth on my other video, the first video about coronary artery disease. So you just go ahead and check that out, and then you can pretty much get the details of this. And by the way, for this, there's way more to the manifestation than just this. This is just the basic level, because there's also the ECG changes, which was tested. So I'm going to do a separate video on that, because I don't want the video to be too long. So stay tuned for that video. I'm also going to put it in a folder. Anyways, let's go over everything. So myocardial ischemia, by the name myocardial ischemia, we know it's the heart muscle. There's reduced blood to the heart muscle. We know the heart is supplied with blood to the coronary artery, so there must be something wrong with the coronary artery. And there is indeed. The coronary artery is not getting enough blood, which means that the heart's not getting enough oxygen. Why? Because it's narrowed or blocked, or because coronary spasms. We went over here, we talk about the normal coronary artery in comparison to the narrowed one, and we talk about how the plaque is a major cause of why it narrows. We know that the plaque takes up space, so it narrows, and then less blood leaves, or reduced blood flow. Reduced blood flow equals less oxygen, right? Causes myocardial ischemia. Now we talk about the spasm. This is the normal artery, and then this is where blood flow is coming out normally, as it should. And then here we talk about the spasm, or it's the tightening, and then this is where there's reduced. Look at this arrow compared to that. So much different in blood. And then we also did like a better visual. You see, look at, this is where it spasms, and then look at the blood difference coming out, like so much less in comparison to what's up here. Yeah. And then we went over the risk factor, the causes. We broke it up into two categories: less supply and more demand. So less supply means these are what causes the heart to have less blood equal, which means less oxygen. The plaque. We talk about how the plaque takes up space, narrows the artery, reduces blood flow, which reduces oxygen to the heart. We talk about the spasm. We talk about it squeezes the artery, reducing blood flow, reduce oxygen to the heart. Hypertension means low blood push. If we have less blood, that means less oxygen. Pretty much. So reduce blood flow, reduce oxygen to the heart. Anemia. We talk about anemia is not just about the blood flow, it's about the blood flow that's rich in oxygen. If the blood going to the heart doesn't have enough oxygen, then still reduce oxygen to the heart. Then we talk about the demand. We talk about the demand in the sense that they don't have a lot of supply, and the body just wants more, so they're giving away what they don't have, so now they have even less. Exercise, you need more, so they're giving away more oxygen than they have. Tachycardia, your heart is beating fast, you're giving away more than you already have. Hypertension means high blood being pushed, you're giving away the blood that you already don't have. Pretty simple. So less supply, more demand, so those go hand in hand. So what we want is a balance, which we don't have in myocardial ischemia, right? So we know that's what we said. We talk about pathophysiology, how myocardial ischemia happens, right? And we went over it in the sense that muscles need oxygen to make ATP. Oxygen is delivered by the blood. If there's reduced blood, then there's reduced oxygen. If there's reduced oxygen, then lactic acid built up, and that's what causes chest pain, which is angina. Yeah. And we said that if the problem with lactic acid is we don't want to be using it for too long. Because if we're using it, that means we're not getting oxygen. And we want to get oxygen when? in less than 20 minutes so we can recover, because if we go more than 20 minutes without oxygen, then we are gonna die of a heart attack. That's pretty much what it is, right? And then we went over the types, or how we see myocardial ischemia manifesting. We said stable angina. We know angina is chest pain, and we know how chest pain occurs. Chest pain occurs because of reduced blood flow. We know that reduced blood flow means reduced oxygen, and reduced oxygen means lactic acid buildup, and we know that lactic acid means pain. We know that stable angina means that it's predictable, so we know when it's going to happen, where it's going to happen, how long it's going to last for, and we know it happens during activity or stress, and it's relieved by nitrates. Then we talk about presmental, which is unpredictable, like they're mentally ill, bro. So unpredictable. Why does it happen? Because of spasms. We know that spasms reduce blood flow, which reduce oxygen, which cause angina. We know it's unpredictable and happens at rest. They're presmental, so they're just at rest and then they just pass out. Basically, no pun intended. And it happens because of smoking, stress, and alcohol. Then silent angina, we don't know it's there. We know because we don't feel any chest pain, but there's still reduced blood flow, but we don't know why, because we have diabetes and nerve damage. So the brain doesn't tell us that none of that is happening. So we can have an heart attack simply from silent angina. And when we think about how we're going to manage or fix myocardial ischemia, we think about supply and demand. Because remember, I said in myocardial ischemia, you have less supply and the body's demanding more. So what do we want to do? Increase supply and decrease how much other people are asking for things from you. And then what we use, nitrates, calcium, black channel blocker, antiplatelets, beta blockers. And I went over this in my first video, so check that out. And that's everything for now, guys. This was pretty long, so thank you for watching. Goodbye.